Prejudice, a physician's journey through unconscious bias. The journey of a physician, especially one navigating the complex terrain of unconscious bias and discrimination, is rarely a linear path. It is a tapestry woven with threads of resilience, empathy, and unwavering dedication, each colored by unique experiences and personal reflections. As a physician who does not identify as white or black, my journey has been no different. Throughout my career, I have encountered the subtle yet insidious presence of unconscious bias and discrimination, both as a recipient and a witness. These experiences, though painful, have shaped my perspective on the importance of fostering inclusivity and dismantling the barriers that prevent equitable healthcare for all. One instance that stands etched in my memory is when a white patient refused my treatment solely based on my skin color. The sting of prejudice was sharp, but it fueled my resolve to advocate for fairness and equality within the medical field. However, discrimination was not exclusive to patients. Colleagues, both white and black, refer patients to specialists outside our local area, despite me being the only physician in town in my specialty, simply because of my ethnicity, even when their family members were my patients. It served as a stark reminder that bias can manifest in various forms, even amongst professionals. Also, explicit bias is infrequent, but implicit bias is pervasive. However, the sting of prejudice resurfaced when denied staff privileges at one of the local hospitals due to my ethnicity. This blatant exclusion fueled my determination. With perseverance, community support, and media attention, I secured staff privileges over 4 decades ago, proving that determination can overcome even deeply rooted biases. Yet amidst the negativity, there were moments of recognition and appreciation. Being invited as a speaker at a regional medical conference of Black physicians and at another national meeting of minority physicians allowed me to share my expertise and connect with peers who understood the importance of inclusivity in healthcare. Being honored by the State Medical Society for my role in changing the law during the Gulf War, resulting in providing discounted medical fees for dependents of active duty soldiers, solidified my belief that compassion can have a tangible impact regardless of race. Furthermore, I have had the opportunity to engage with communities beyond the walls of my office, such as giving talks on medical topics in Black churches after Sunday services and at their health fairs. Gestures of appreciation from the Black community, like a wave from a passing driver and a heartfelt thank you from a patient who genuinely appreciated my care beyond my skin color, served as powerful reminders of the genuine human connections. These experiences, alongside caring for over 53,000 individuals from diverse backgrounds and nationalities throughout my career, crystallize my commitment to treating each patient as an individual, regardless of their skin color, ethnicity, or socioeconomic status. I transformed those experiences into a burning passion for personalized care, ensuring each patient received the respect and dignity they deserved. The golden rule became my guiding light, reminding me to treat every individual as I would want to be treated. Despite the challenges, optimism fueled my resolve. By acknowledging bias, embracing inclusivity, and celebrating the unique stories of every individual, we can build a world where healthcare is truly accessible and equitable for all. One particularly memorable encounter involved caring for the grandson of Mahatma Gandhi. Through our conversations, I gained a profound understanding of Martin Luther King's inspiration drawn from Gandhi's philosophy of nonviolence and civil rights. This experience further solidified my belief in judging individuals based on their character and individual needs, not their background or skin color. My journey has been a tapestry woven with threads of hardship and heartwarming experiences. Every patient's story has taught me resilience and underscored the unique strength of the human spirit. Their courage inspires me to approach every encounter with empathy and unwavering respect. Arriving in the U.S. as a young doctor over 50 years ago, I was welcomed by a white family with 8 children. This act of inclusivity and hospitality from a family unlike my own allowed me to stay with them for months before joining my internship program. It cemented my belief that personal connections and genuine human relationships can transcend racial barriers and foster understanding. Throughout my 4 decades of solo practice in the same town, I've cared for over 53,000 individuals from diverse backgrounds, many for decades. Each interaction, whether with a 12-year-old Black girl battling type 1 diabetes, a middle-aged man seeking guidance after incarceration, or a young law enforcement officer starting his career, reinforced the critical need for cultural sensitivity and personalized care. These experiences ingrained in me the importance of treating every patient as an individual, regardless of race, ethnicity, nationality, or socioeconomic status. They all have their own unique experiences, struggles, and triumphs. Their stories are a constant source of inspiration and resilience, reminding me to approach every encounter with humanitarianism. My experiences ignited an unwavering flame within me, a commitment to personalized and humanistic medicine with full awareness of social determinants of health. It's not just about curing illnesses, but about caring for the whole patient. I strive to recognize the unique stories and needs of every individual, regardless of background. Every encounter became an opportunity to confront bias with empathy and respect, building a medical practice where everyone feels seen, heard, and valued within the powerful therapeutic relationship between physician and patient. Despite the challenges and rewards of my medical practice, it also fostered deep bonds with patients across many diverse backgrounds. However, I was fortunate to retire happily at the start of the COVID-19 pandemic, leaving behind a fulfilling career, even though many long-standing patients, particularly older individuals, expressed their desire for me to continue practicing. Physicians stand at a crossroads now, challenged to harness the potential of AI in medicine without compromising their profession's core values. Despite this added pressure, I believe the young generation of healthcare providers possess the power and responsibility to build a world where healthcare is accessible and equitable. This world acknowledges and addresses bias, ensuring every individual receives the kind, compassionate, and common-sense care they deserve without any prejudice. Empathy and respect will forever be our guiding light. Thanks for watching. Share your thoughts in the comments below. Subscribe for more thoughts-provoking content.